A very good morning to one and all. Today's topic is on which muscle should we have to manage to completely alleviate which disorder. So it's a kind of tricky question and a tricky topic, but still I would try to work on it. Before starting the session, uh, let's start with a small prayer. Ramo Ramo Ramayiti Prajanam Bhavan Kathaha Ramabhutam Jagadabhut Rame Rajyam Prashasati Amogham Balaviryam Te Amoghaste Parakramaha Amoghaste Bhavishyanti Bhaktimantascha ye Naraha Amogham Darshanam Rama Nachamoghastavastava Amoghaste Bhavishyanti Bhaktimantascha ye Naraha. Thank you. 4 days back, it was the day of Ramanavami. So saluting Rama. Before starting with the session, I would start with a small story. Usually story doesn't come in the first. Hi. But just to give the direction to the session today. So there was this old granny, and she lost her sewing needle. So she was in the street light down on the road. She was actually looking for her needle. So there comes a small boy, and then thinking that this granny is so old, I have to help her. So he also tried to help, and he was asking, "Oh, granny, what are you looking for?" She said, "I lost my needle. I have to find it out." So he also tried to search for the needle. After a while, he was so in vain. He asked, "Where did you actually lose? Just give me some clue so that I will try to find out on that place. Otherwise, it is just scanning throughout the road. It is very difficult." She said, "While I was in my kitchen, I lost my needle." "Where is your kitchen?" "It's in my house." Where is your house?" "It is a mile away." "Why is it a mile away and then you're searching the needle on the road?" She said, "I don't have lights there. I'm a poor old lady. So I have to search in the street light. So that's why I'm searching it here." The story is very foolish, it's dumb. But we are all, lucky old dumb grannies ourselves. Why old dumb? Because we are searching the problem somewhere else, searching the cause for the problem somewhere else, and trying to work on the areas somewhere else. And why lucky? Because we have this intellect so that we can later on analyze what we have done wrong and then, try to recover our all mistakes. The topic is importance of muscles over healing. But before understanding which muscle has to be activated or which area has to be focused more in treating patients, be it yoga, be it physical therapy, be it essential oil therapy, what Manish just had been discussing of, we should understand the psychological reason behind every common ailment, every psychosomatic ailment. And as you all know, World Health Organization has declared 93% of all disorders are psychosomatic. So when you know what is the cause, where is this psychic cause, you will work on the cause better rather than working on some other instrument that we, that is tangible, we feel it, we see it, So I have a few lists of problems and the psychological causes. If you want, you can note it down because it could help your friends. If you don't have any ailment, it will actually help your friends, your mother, your family. So if it is a heart-related problem, an angina, a CAD, or hypertension, call it any. The basic reason behind heart-related or cardiac ailment is the holding of oneself, holding oneself from joy and love. Heart chakra is the seat of all emotions, we say. And it is the seat of unconditional love. So there are people who run in this rat race like anything, crazy rat race like anything. They forget their family. They forget their, importance of pastimes, hobbies, cultivating the time for such aesthetics, They lose such areas in their life. They lose these important arenas in this life, So I recently got a pic, through WhatsApp. I just wanted to show you once about it. Yeah, it's over here. So how to measure success? We were taught that if you have a good job title and a great salary, that is what success is. This is how a person, a normal cardiac risk-oriented person thinks. But what is a better measure? If you have free time, if you have time for family, if you have time for doing things what you like playing guitar, playing veena, for example, if you have time for cultivating some time for exercising, for your physical health, for your mental health, along with a good job title, along with a good salary, good amount of salary, that is what exactly is success, is successful life. When people ignore this, they tend to have hypertension. They tend to shoot their blood pressure because there is no amount of joy. There is no element of joy, any source of joy in their life because they had kept their schedule so tight, so busy, thinking that amassing wealth, getting high paid salary is success. So that's the basic cause. When you have a head related problem, like migraine, sinusitis, what is or a frequent headache? It's just not be migraine, it can be headache also. When you get these frequent headaches, what's the reason behind? What is that emotional imbalance that we have? Such people think that there is seriously something wrong in us. There is seriously something wrong in our decision. For example, I should tell about me myself. I get this frequent headaches, and then when I came to know that my haunting of this thought that okay, marrying to such a person and coming down to completely different structure of life, completely different location. Although I belong to the same nation, but the as I have been keep on saying that both the dimensions are completely north and south pole apart. So I've been haunting myself with this thought: was my decision right? You know, when I came to know that this is that emotional imbalance which is creating my headaches, frequent headaches, or that emotional upset because of this thought. Believe it or not, when I tried to avoid and then completely accepted that Gwalior is the city where I live right now, is my hometown. This is my house, you know, this is the land of my profession. When I tried to accept those things, all those headaches vanished. It is not that I'm always dramatically expressing, but really speaking, truthfully speaking, it is this area that you have to work when you have such kind of problems. When you have a hair problem, when you have a hair loss, you know, hair loss is such a common problem where you can see, you know, that the reason behind is lack of inner strength. The inner strength is what gives you the physical strength. The inner stamina is what gives you the physical endurance. Okay. Um, how does it work? For example, you are in the posture of Dhanurasana. It is not a comfortable posture, but that thought inside you, no, I'm going to stay at least 20 counts, how much ever the yoga instructor wants me to stay with. Hmm? So you, in fact, are counting along with the instructor. 20, 19, 18. Your back is hurting. Your abdomen is hurting. But still, that inner thought saying that, no, this stretch is supposed to be a useful stretch for me. This is what is going to manage my diabetes. When you have that resilience, emotional resilience, naturally you are able to hold that posture for 20 seconds, which you could hardly even do when you're all alone, right? So there's the simple mechanism, the simple relation between inner strength and the physical strength. So when you have that inner strength, there is physical strength, and not much of muscular tension and physical tension is formed, and then all these hair fall issues can also get relieved. There are other pathological causes also with hair fall. I should necessarily say this: hair fall is completely related to stomach ailment. When you are constipated, you will definitely have hair losses. So put a check over your diet, inclusion of lots and lots of figs, raisins, you know, to relieve of all these constipation issues will actually help. Sorry, Stefana, can I mute you down? Thank you. So this will actually alleviate hair losses and all the problems related to the thinning of hairs, you know, dandruff issues and all those things. Coming back to stomach related ailments, might it be diabetes, IBS, constipation, you know, irritable gastrointestinal system, you know, very easy motions getting loose, you know, sticky motions, and all those things. Huh? All these stomach issues, acidity issues, are because of the psychological reason that people do not assimilate any new thing that comes up in life. When you're put into a situation where you have to express new ideas, or there is some completely different things happening, what you haven't been experiencing, so you develop this fear of new experiences. You develop this, you know, resistance towards new things. You know, you're happy in your own comfy circle. Huh? When you do that, you have this stomach problem, and hence I see so much of correlation between relationship issues and stomach problems. You know, Why? Because when you start a new relationship, again, you're fearful about the new experience. How would the person be? Mm. When you're already into a relationship, every day the person seems to change and throws up some new things over you. Again, this was the person. Did I love him? No, he was completely different. Why is he acting in a completely different manner? Why is he? That is very new to me. So that kind of emotional, non-acceptance towards new things in life, new experiences in life, that is going to disrupt your gastrointestinal system. Hyperacidity is also one reason, is also one consequence of such problems. Moving ahead, when you have some problem in your neck, like it is not just the frontal neck, I'm talking about the ventral region, the posterior region, like cervical spondylosis, stiff shoulders, frozen shoulders, such issues is caused because of your stubbornness in life. When you're too stubborn, when you're too rigid, that rigidity actually implants over your shoulders. And that's why when I give Shavasana to people, when I instruct to people, when I say to relax your toes, relax your knees, when I particularly come to the shoulder blades level, I say, release all the burdens that you have from the shoulders. The moment they come out of Shavasana, they say, ma'am, when you say that the burden is being released, I felt that lightness in my shoulders. The two areas where we collect the psychological tension is your shoulder, the scapula area, and your glutes. Even while you sit, you're actually constricting your glutes. And when you do that Makarasana, the prone lying posture, what actually happens? You feel relaxed. Why? The moment you relax your glutes, your buttock muscles, you relax well. So when you hold that muscular tension over the shoulder blades, then that actually creates the cervical spondylosis or the frozen shoulders things. And this rigidity is because of your mental toughness. It's not the toughness, I'm sorry, toughness is not the right word, stubbornness. Stubbornness about anything in life. What is priority in my life is very much priority. That thing. These people actually has this problem of inability to see the other side of equation. So when you are open-minded, when you could see the other side of the equation, actually the problem solves. But on the other hand, they think they are intellectualizing the problem very well. They are judging the solution very well, and they are going to administer all those solutions very well, and then taking all those responsibilities over, burdening themselves completely. And then when someone is suggesting anything, no, this is not going to work. I've been doing this many a time, but it didn't work, Non-acceptance to suggestions. That is the kind of stubbornness I'm talking about. This is very, very injurious because this can create cervical spondylosis. This can create any neck kind of stiffness, shoulder stiffness. Now, when you have the problem in your throat, like hypothyroidism, there are many autoimmune disorders like thyroiditis, Addison disease, many things for that matter. So such throat disorders occur only when you feel inadequate to stand up for yourself in life. There is this constant feeling that says you are being dominated and you're not able to you're not able to open up. You're bottling up all those events, all those experiences inside. When you gulp all those bad events inside, then there is problem in your throat chakra, and you shall be. I think I mentioned this in the chakra lessons also. You might be hypothyroidic. There's this self-esteem that you have to establish. So when you establish yourself in the self-esteem, then these things will be removed off. The another cause is the repressed anger. There's some past event that had happened in your life. You're not able to forgive the person. You're not able to let go the situation. It is constantly haunting you back. That repressed anger can also create throat issues. The next one is the most common one. Back, lower backache, middle backache. People who has this lower backache, I find them, some way or the other, feeling that inability to to progress themselves in their profession. They are always in need of some financial support, in search of money, or sometimes the reason can be in search of recognition. When this search for recognition is not over, and they're always wanting for it, they develop that spasmodic muscles in their lower back. So this is the major reason for all lower backache patients. This is a small homework that I did in this week, analyzing all those patients since 2006 I've been working with. So it has been 13 years. So I should say roughly around 200 to 300 people I've been treating. So this is a small workout. This might be wrong. This might be right also. So it can give you a generalized picture. And you can't you can't make them fall into a category. Many a time we do Google our own disorders, our own diseases. It's such a bad habit that we do, because we cannot put ourselves into that compartment where we can generalize items. It is like understanding astrology through our planetary motions on our all by ourselves. It can't happen. We cannot put ourselves, but you can definitely have a general idea over. So that's a disclaimer. So lower backache. With middle backache, I found patients with much of guilt, one who held back love. They couldn't express love to the partner properly, or couldn't marry the person who they loved. They get this middle backache, and then these people are always lacking emotional support because of that. So lower backache is because of financial support. This is emotional support. While speaking this, I have to definitely mention most of the middle backache issues are connected well with your stomach. When you have this gastritis and acidity issues, you often get this middle backache. So you have to treat such patients in treating their stomach related issues also, and their emotional area also. With knee, there is a large amount of elderly women getting troubled with rheumatic disorder, rheumatoid arthritis, osteoarthritis, and 85% of all those rheumatism and osteoarthritis hits their knee. I do not know why, but it's basically because of, I should say, the people usually call this as male ego, but I call this as female ego. Female egoistic issues. What is this female egoistic issues? Is the adaptability, inability to adapt to situations. Sometimes we need to flex to, to win the situation. When there is flood happening, when you have floods in your rivers, strongest of the strongest trees, the barks, the oldest trees also gets flushed off with the flood water. But what about those tendrils? Huh? They sway with the wavy water and they are stayed back. They don't get demolished. What's the life lesson that you get from the nature? And when you flex to situations, when there is opposing situation happening, when there is flood-like opposing situation happening, you need to flex along. You need to let go. So such issues are found with most of all females. I'm not very particular, but yes, we have these adaptability issues. So ego issues and adaptability issues, constant worry, constant resentment over, oh, why didn't I budge in? Why didn't I give in? That emotional upset can create knee disorder, knee pains. And then with these knee patients, the problem is knee pain is so worse because they are incapacitated to walk long, to stand long, cannot shop well. That's what females are. They love shopping. They cannot stand long because their knees hurt. Now, this itself is a bigger stress for them. With knee pain, the pain in the knee itself is an emotional upset, because they feel they are incapacitated to live life fully. So I learned this from a doctor. The doctor actually treated a patient. The patient had a stomach ache. So he said, I'm constantly, ulcerative. I have a stomach ache. So the doctor said to the patient, the pain is in the stomach. Do not take the pain over your head. The patient didn't understand at the first go. So this is what I actually tell all my patients. The pain is in the knee. Why do you have to take it in your head? Let the pain remain in the knee. When you take it over to your head, that actually itself is a stress trigger. So the pain receptors, the neuroreceptors from the brain actually stimulates more of pain in the knee. Why do you have to do that? Intentionally exaggerating the pain. Why should one do that? So with knee patients, you have to be very careful in dealing with them because they are so much overstressed and exhausted and egoistic also. Lung, the major issue. And the entire pandemic situation is creating a great havoc because the lungs is what it hits. And then the next is the heart. So how to keep this lung healthy? Of course, pranayama, breathing techniques, bastrika, brahmari. There are many, many, many yogic techniques. But what is that emotional correction that we have to do? Every person in this world had encountered with some or the other bad event in life. We have tasted bitterest of the bitterest. But when you hold on to such bitter experiences and then suppress those bad events in life, that is the cause of your bronchioles and bronchus getting weak. And hence you become easily allergic. Allergic to Congress plans, allergic to pollen, allergic to dust. And that weakens your lungs, weakens the capacity, the forced vital capacity of your lungs. So the first and foremost thing that you have to do is let go the person whomever had wronged you, had insulted you, had terribly, shaken you off. When you hold on to that past event, then it will definitely weaken your lung. So for lung patients, I usually say live life fully. They don't live life fully. Why? Because this constant thought in them that I'm being dominated by my boss. I'm being dominated by my life partner. He has given a hard time to me. You know? So that suppression, that suppression of past wrong is very wrong. Mouth. When you have a mouth related disorder, any oral disorder, what is that reason behind? It is because of the closed mind. These people easily set opinions over people, and however the circumstances change, they do not say that okay, the person has changed, so I have to change my outset, my opinion about it. No, they behave in the same manner because they have already had this preconceived thought about the person that this is how he will react. He is perhaps being good just because he have to show off himself. So that is that inability to understand, look, I am also changing, persons can also change. Inability to perceive change in life. They get these oral disorders, and then you can very well see with this amount of bad breath that they throw while they speak. They use mints, these are the people who smoke cigars. These are the people. When you have a nerve related disorder, like it can be lumbar spondylosis, it can be the twitching of the eye, it can be any pain all over the body. They feel pain all over the body. They get exhausted very easily. Sometimes it might be a nodes pain, it might be a elbow pain. It is not definite. This is all nervous disorder. Weak nerves. And this happens because of anxiety, confused thinking. Even while they speak, they speak in broken sentences, and they try to speak a statement and then suddenly remember some other thing, and then they try to reiterate the thing. So that's how they speak. The confused thinking actually makes this distorted speech in them. Fear of future, fear of death is an important factor which can actually weaken your nervous system. Hence, Vedanta is very, very important. Vedanta says death is part and parcel of life. Accept it. Change is part and parcel of life. Accept it. When you have a breast disorder, breast cancer is very, very common among all women. The emotional conflict that breast cancer patients have is over-mothering. See, you can see over-mothering, Imola. Over-mothering is, these psychologists have actually taken the word over-mothering out and then started up a new coined a new name. They said too good mothering. So when you think you are a too good mother, and then you give plenty of love towards a person, and then you're not only disrupting the emotional development of a child, but also yours. So that actually risks breast cancer also. And it is not only over mothering, the reason is, but also overdoing any place, anything. With by saying overdoing a thing, I mean, look, you are into a profession, okay? You are working for a firm, for a concern, okay? But you put plenty of time, efforts in doing that piece of work, or in making that work better. By doing that, sometimes what happens, by overdoing it, you develop a kind of attachment towards the work. You become workaholic. Like that same way a overdoing mother, a over mothering person does. She doesn't give options to her child to grow through. She keeps all the things ready. While a child goes in for the bath, to take a bath, when he comes out, he could find all his clothes ready ironed before him. That's how too good mother does, right? So this is actually not being too good or very good mother, but actually disrupting the development of the child and also one's own. So I'm not saying you should not do your job diligently and work honestly. Yes, you should work honestly. As I mentioned in the slide that I showed you, working for the good of others, working for the good of our own self is most important than doing the job better, than beautifying the piece of work. Bladder infection, people get kidney, renal disorders and urinary bladder disorders. That's because of conflict and frustration. We'll quickly move through because muscles is what we have to work upon. When you have a colon disorder, there are more and more cancer patients related to colon, related to rectum, all in the West that I could see. This is basically because of their intake of flour, bread and pita and lots of pasta. Always it is the maida, it is the refined flour use that they have. But other than that, the psychological cause that people have found is inability to let go, inability to give the control of their life to others. I am the person, I am the breadwinner, I'm going to control all the family affairs. I'm going to take the major decisions. That inability to let go, that kind of ego. There are three areas where we become egoistic. This egoism is inability to let go of control over one's own life. And hence, Bhakti Yoga says surrender. Why do you have to, um, nurture disease within you? Don't nurture disease. Just let go and surrender yourself. Sharanagati, some. Leg problems. The next is leg problems, varicose veins. So many people, I do not know about Romania, but many of the Indians that I see who come into contact, who call me, now claim about their problems with calf muscles. Their calf muscles are tight. They are either running a lot or they are not sleeping properly. Sometimes over-exercising can also create this leg pain. Sleep leg syndrome is one another disorder which is coming up very lately, very common, where they shake their legs all the time while they sleep. And then because of that, their quality of sleep is also disturbed. So actually, the reason is better quality of sleep. They don't sleep at proper time. And the second thing is over exercising. Rather than this, what is the emotional reason? Reluctance to the future, inability to move forward. They think that they have to progress in life. Some or the other obstruction happens. It might be their own colleague pulling their legs down. It might be his boss or sometimes life partner themselves. You don't have to work, the other area, the other end of the Romania. You should be here only with me. It can be your life partner also. I keep on saying this, life is not a plum cake. It is not easy. It would have bitterness, it would have sweet, it would have sour taste, it would have uh, all the taste, all the flavors. Amongst all opposing situations, how hard and how resilient you are, how easy going you are at the same time, makes you a better personality. I chanted the mantra on Rama. I chanted the shloka on Rama. The entire life of Rama is nothing but I call a stress ladder. You know, his kingdom is lost. It was his parents themselves who threw him out of his kingdom. His wife was abducted. He had to live a life of a rishi, a seer, without even slippers, on his foot. He has to run, he has to walk barefoot, he has to wear bark of the tree instead of clothes. Such hardships of life he had for 14 long years. After 14 years, then he got his kingdom back. He won the war. He got his wife back. He got his kingdom back. This all story ends good. But 14 years of life is what we call as midlife. And that is where we also live, no, midlife crisis, right? But how did Rama live his midlife crisis? He was strong, resilient, at the same time humble, polite, easygoing. You can definitely say he was a god. He can, emote in such a manner, however he wants to. He has that perfect control. No, he did not in any part of his life, in any moment, show that godly power in him. Why? Why did he live life like a human? Just to show even a human being can live life like him. Even a human being can learn life lesson from him by being him, by seeing him, by meditating him and becoming him. So that's the idea, that he didn't even show any kind of magical powers. He lived life flesh and blood human. Okay, coming back to the problems. So leg problems is because of inability to accept future or any opposing situation coming up, and that stress haunts you. If such opposing situation comes, you have to be a hard rock, you have to be an easy salt which can dissolve in water also. So the same time, that opposing characters make you a fully blossomed personality. Anyways, diabetes mellitus, another, the world itself has become diabetic capital. Diabetes mellitus is not only a lifestyle disorder, but also a metabolic disorder, but also an endocrinal disorder. So such huge the causes are when you see the pathological evidences. But emotionally speaking, people who develop the attitude, the tendency to oversave, I should say credit cards was not there 25 years ago, right? People were using debit cards, whatever they have saved in their bank, they spend. But now they have this freedom to overspend and later on they have developed this tendency to save. Oh, I have to pay off my credit card bill, so I have to work more, I have to toil more, I have to save more. So this over saving tendency had created diabetes. So much of selfishness have been brought inside this self. Pathetically, credit card, I found credit card, my husband had 3 credit cards. I said, stop one, I do not want one. If you are happy with 2, okay, do with the 2. He said, I cannot even resign the second because the limit is very small. I said, that's okay, no problem, have that one. but you have to put a parenthesis of your money that you accrue, money that you spend. When you could enjoy that habit, when you could develop that tendency, you'll be out of all those stresses. Credit card stresses is so much. Uh, and then these people also have this ability, also have this tendency to keep things in their own control. This attitude also creates diabetes mellitus. How much ever I could see, I could analyze people. This has also created diabetes mellitus. Anyways, now coming back to the main theme of this seminar, of this session, which area that we have to focus more on, what disorder? Is that a muscle? Definitely 2-3 muscles I can say, but more often it is not 1 or 2 particular muscles that we have to focus upon. If Manish would have been there, then it would be very helpful, because Manish being yoga instructor, all the yoga instructors out there, I'm telling you all that these areas that you have to focus upon while you instruct a module or yoga module to your participants. When your participants have allergies, it can be skin allergy, it can be nasal allergy, it can be any dust pollen allergy, any respiratory system oriented allergy. The first and foremost thing that you have to focus upon is Sukshma Vyayam, strengthening the joints. Sukshma Vyayam is that, every joint is being strengthened. We have extension flexion for tarsal joint, extension flexion for rotation for wrists, shoulders, elbows, scapula behind, shoulder, middle back vertebrae, lower back vertebrae, hip flexors and extensions. What did I miss? Shoulders and armpits, knees, ankle joints. Carpals and metacarpals, tarsals and metatarsals joints. Every joint has uh, what should I say? An area where you can work with their extension, flexion, adduction, abduction, opening up of the joints, basically, strengthening these joints. In yogic terminology, we call it as Sukshma Vyayama. Dhirendra Brahmachari, a great yogi of 1970s, 80s, a Himalayan yogi himself, had developed this module for all these joints. This, if you focus on Sukshma Vyayama more, allergies can be, definitely managed well. Alzheimer's disease, very common with elderly people. Dementia, memory loss, very common with childhood, teenhood and adulthood people. When you focus with all the other asanas, when you could focus them with the love for aesthetics. If a person loves to dance, he should spend time dancing at least for 30 minutes, or learn dance, put him into a dance class. Or if you have the flair for, playing guitar, if you had in your childhood played veena and then stopped playing the veena at all, you have to start those habits. When you could enhance the right brain orientation well, the left brain also works well. That's the place where you strike balance between right and left. Of course, pranayama and breathing techniques in yoga can help Alzheimer's disease. Asthma. Can you please spell here the name of the Himalayan yogi? Should I write it?
Hi, sorry to interrupt. I didn't remember the Hindi word you said. Connected to the joints. I'm interested in listening
Right.
more, and I cannot write it because I don't know how to spell it and search more information about it, please.
No problem. Sukshma.
Thank you.
Vyanaprana. is the technique's name.
Thank
Dhirendra
you so very
Brahmachari.
much.
No
Thank you.
problem. No problem. Dhirendra Brahmachari is the one who propounded Sukshmayama techniques. So I suppose Jalba is a yoga instructor. Good. Asthma and the other disorders, even for the protocol for the prevention and managing COVID-19 and COVID mutant, we work on these areas. We work on extension of chest and shoulders more, and purification of respiratory system with kriyas. Kriyas, I should write the spellings once again. These are called Shuddhi Kriyas. Okay, Shuddhi Kriyas, sorry. Shuddhi Kriyas. These are the techniques, yogic techniques for the purification, for the cleansing of respiratory system and also gastrointestinal system. We have very many techniques, very many kriyas for cleansing different areas. I used to, uh, uh, in a comical way say that all the holes that you see, all the 9 holes that you see, we have cleansing technique for all the 9 holes, starting from the top till bottom. So these are the areas where extension of chest, shoulders, pranayama, cleansing techniques, breathing techniques can help. So diaphragmatic breathing in particular will help. Asthmatic patients will help. Any kind of respiratory disorder, even for COVID-19 and COVID mutant problems. The next is hypertension and cardiac ailments. Again, Sukshmayama, strengthening joints. It is because lots and lots of prana is stuck up in the heart. Because their inability to accept joy and love, they have stacked up so much of bad energy in their heart area. So we try to divert those energy, channelize those energy towards limbs, towards hind limbs and forelimbs, towards the hands and your legs. Hence, most of all the joints of the hands and legs are used. Other than strengthening the joints, Sukshmayama, we focus on balancing asanas more, like Garudasana, Vrikshasana, Bakasana, Natarajasana. So many balancing asanas can help, because these patients have this tendency of ego a little, and hence they find their gait to be imbalanced. They don't walk properly. They don't while they walk, they find their stability to be missed. So for that, we train them with wall support first, passive stretchings, and then we make them do more and more of balancing asanas that really help in their rejuvenation. Cancer, HIV, autoimmune disorders, thyroiditis, Addison's disease, Graves' disease. There are many autoimmune disorders. For these patients, of course, asanas, pranayama will help, but the major area of focus should be reverberational chants, continuous reverberational chants. Why? Because to bring in any kind of cellular change, there should be a drastic change in the cellular level. The prana that we focus upon is Vyana. There are 5 kinds of prana. The 5th kind is called Vyanaprana. Let me write that out. Okay. Vyanaprana. Okay. Vyana means the energy, that vital energy which runs through entire body. Hence, it takes care of circulatory system, nervous system, even the cellular structures. So to bring in transformation or channelization of energy in Vyanaprana, mantras have an emphatic role in changing these structures, you know. Hence, we actually make them chant in a repetitive manner, so that it creates a constant reverberation in all the areas, from top till bottom, from the head till toe. For example, we make them chant Mahamrityunjaya mantra. This is a very effective mantra of Yajurveda on salutation of the healer. We call him as Vaidya. We call him as the doctor, you know, himself, Lord Shiva. The chant goes like this. It's very reverberation, very powerful. Om Trambakaya Jamahe Sugandhim Puštevardhanam Urvarukabiva Bandhanat Mrityormukshiya Mamritaat. If you chant every sect of this quite a few times, you would find that reverberational effect. It is just once you are hearing, but while you lie down and, you know, when you are made to chant this mantra, you will feel amazing energy. And this is an advanced technique modeled by S. Vyasa, S. Vyasa University, Bengaluru, which they call as MSRT, Mind Sound Resonance Technique. So along with asanas and pranayama, we actually involve them in doing such advanced yogic techniques. And we also make them do japa. Japa is continuous repetition of one syllable, you know, Rama, Ram, 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 Sita, Ram, 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 or Om, 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 Om. Sorry for my voice. I've been speaking continuously, so I'm not able to chant properly. So that continuous repetition of japa mantra can also help in autoimmune disorders, menopause-related disorders. Now, perimenopause, post-menopause, or during menopause, you know, when you have such disorders like hot flashes, high elevated heart rate, anxiety, irritability, stomach upsets and emotional upsets, mood swings, these can be very much alleviated. I should not say managed, completely alleviated with slow rhythmic breathing techniques. We call them as breathing techniques because we do not we also make them do pranayama, but pranayama and breathing techniques are entirely different. These breathing techniques involve physical actions like inhaling, you open your arms completely and expand your lungs. Exhaling, you bring them back at 90 degrees just in front of your shoulders. So when you do this with awareness, with closed eyes, and try to slow down your breath, lengthen your breath, deepen your breath as much as possible. It relieves so much of stored up stresses and tensions, and also relaxes from all such menopausal symptoms. Chronic pain, any chronic pain. It can be knee, it can be lower back ache, it can be a middle back ache, it can be a cervical pain, it can be your neck discomfort, shoulder discomfort, anything for that matter. When you have such chronic pain, that particular area has to be focused. If it is a knee, then knee has to be focused. Extension and flexion can definitely help, but what I personally saw is twist and rotation of that particular area helped a lot more. Basically with back, lumbar twists, lumbar rotation, pelvic rotation, had actually helped. Even with sciatica, twist and rotations and stretches had helped more uh, of sciatica pain, of that iliopsoas major muscle, and also the hamstring muscles. Cold and flu. If you have frequent cold and flu or sinusitis, what is that area that you have to work upon? Cleansing techniques once again. Shuddhi Kriyas, as I mentioned in the chat, Shuddhi Kriyas are the cleansing techniques, the cleansing Kriyas of yoga, which cleanses the entire respiratory tract, even the synovial area, the sinus area around your eyes, around your forehead, at the ends of the nasal septum, you also have this sinal area. So from the eyes, head, forehead, and till the end of the nose, you have different cleansing techniques. One of such techniques is most popular, called the Kapalbhati Kriya, where we actively exhale through our abdomen. This is a Kriya. This is not a Pranayama. This is a Kriya. It's a cleansing technique. This actually helps in clearing of all the sinus area around your head and eyes. Depression. Oh, with depression, you have to work on multifaceted areas. Apart from asana, pranayama, intense workout, lots and lots of, we call it a Shithilikarana Vyayama. Let me just chat it out once again. Shithilikarana Vyayama. These are basically asanas, but combination of asanas done in very rhythmic, quick manner. Like you have heard of Bhujangasana. You also have heard of Parvatasana, upward dog and downward dog posture. So when you do these postures rhythmically, up and down, up and down, up and down, and there are very many other, in fact, millions other, I cannot even name one. So as many asanas, as many Shithilikarana Vyayama. So when you do that, it actually helps in getting off with low moods, mood swings. You can beat the blues very quickly when you do involve yourself in such Shithilikarana Vyayama exercises of yoga. And have check on your vitamin B6, vitamin B12, and vitamin D. When you could bring in the balance in all these ranges of vitamins, then depression can be chucked out from the system. Diabetes mellitus, once again, intense workout is what we emphasize upon. More and more of abdominal compression, lower abdominal compression, where it is not that we have to increase the efficiency of pancreas, because it is not diabetes insipidus that we are working. Diabetes type 1 is not that we are working upon. We are working upon the cellular structures. But even then, when we compress the lower abdomen, we found in the arena of yoga, yogic researchers, there is equal displacement of prana all over the body. And hence, Dhanurasana, Navasana, Naukasana, Viprita Naukasana, all these abdominal, Mandukasana, all these abdominal compression asanas helped in, working with the cellular structures. Of course, while I speak about cellular structures, chants, mantra chanting can definitely help with diabetes mellitus. Apart from that, there are very many other things that they have to sleep well, sleep at right time. And if they do not fast, they should be involving themselves in fast. I do not know why doctors say that diabetics should not be fasting. Intermittent fast can definitely help in bringing the blood glucose levels down, and this had been seen in very many patients, not only observed in very many patients, but also researched over quite a long time. Because that it actually helps in making the old diseased cells to die and bringing in new regenerative cells to come up. So intermittent fasting had definitely helped in diabetics. So it is not that you have to go on for 16-hour intermittent fasting at one go. Start with 8-hour and then extend it with 10, 12, 14, and then 16. But females, please go for 15 hours or 14 hours only. Liver disorders, like we have problems like elevated SGPT, SGOT, and fatty liver disorders. With these things, we focus upon their sleep time. Why sleep time? Why not quality of sleep? Definitely quality of sleep comes with sleep time. If you're going to sleep right at 10 p.m., right at 10 p.m., it can't happen when you lie down at 10 p.m. and then you sleep at 10. You have to lie down at 9:30 so that you develop that sleep at 10. Ayurveda says the clock, even the acupressure, all the alternative medicine says the same thing. The clock of liver, when it gets active, is at 10 to 2 in the morning, 10 p.m. from the night to 2 in the morning. So liver is that detoxifying organ itself. All the toxins can be flushed out once when the liver is active. And liver is active with this period. It needs the person to just sleep off well. If he sleeps, then the liver can work it at its 100% efficiency. So 10 p.m. sleep is very, very important for all those liver disorders like cirrhosis, fatty liver disorder, grade A, grade B. All these are completely reversible. I've seen patients, I've seen grade 3 cirrhosis patients, who are about to die. It's just last option possible. That was yoga, doing yoga, working with their cigar and alcohol habits, and sleeping at 10 really worked well. With liver disorders, it is the, yeah, Johanna.
Because we have this summer time now, they changed the time with an hour in the summer. Should we then adjust to this, or should we go on with the 10-6 kind of?
Ayurveda does not speak about any bondages of land or time, so 10 p.m. is 10 p.m. 10 p.m. is 10 p.m. whether it is winter, whether it is summer. In fact, summer you need to sleep a little earlier, because you tire a lot because you are out a lot. Exposure to sun, exposure to people are a lot, and then you tend to be active more in summer, less active in winter. Hence, sleeping off little early is always better in summer. Now, coming back to liver disorder, lower back is what you have to manage well, and abdomen. Rectus abdomen is the muscle. If you're going to work upon all those asanas which could influence your abdomen, which could influence, which could strengthen your lower back, liver is going to be fine. With kidney, kidney and heart are brother and sisters. So if you work on chest expansion, if you work on side lunges, if you work on waist compression, then also kidneys, renal problems can be managed. And apart from that, good hydration, good sleep. I usually say calf muscles are the second heart. Okay, why? Because calf muscles are the muscles which actually push out the deoxygenated blood through veins to the heart. for purification. So if purification is done properly in the blood, the calf muscles are strong, then you will hardly get any heart or kidney related problem. So the next important thing is calf muscles to be strong. And the related thing is calf muscles get tightened and it pains only when you don't sleep properly. You get a knee pain when you don't sleep properly. So sleep is another major factor. Sleep at 10. Menstrual disorders. There are lots and lots of young females. Problems with infertility, problems with puberty, problems with irregular menstruation, heavy menstruation, amenorrhea, painful period, dysmenorrhea, so many rheas. What is that we have to focus upon during while you give a yoga module? Definitely, yes, all those prone and supine postures can help. Breathing techniques can help. But apart from that, one who do not get proper menstrual, scanty periods, PCOS, polycystic ovary syndrome or polycystic ovary disorder. This is getting very, very popular amongst the young, female society. This is because of intake of lots and lots of maida, refined flour. So if they could switch over for whole grains in their diet, that can help. The second reason is improper hydration. Me and a homeopathic doctor, she is also female, both work together with PCOS a lot. So yoga and homeopathic medication along with such corrections in their lifestyle helped. So intake of maida, intake of refined flour has to be, considerably reduced. Lots and lots of hydration, lots and lots of water has to be included. Lots and lots of chants. Rig Veda says this menstruation is guarded by 3 different deities: Varuna, Agni, and Gandharva. Gandharva is the deity for singing. So when you sing out loud, being a female, who are you? You sing well, you dance well, that's how you are. When you lose that feminism inside, there's some kind of natural explosion happening. There's some kind of derangement happening inside. So lots and lots of singing and chanting during this time, during the menstruation itself, will help your young girls, young girls around your aunts, your mothers. Please do a propaganda of chants. If you have your own Romanian songs, old folklores, ask them to sing out loud with them. That way they can connect very well to their roots. That way they will definitely connect well themselves with their, original nature. So this is all I have to say. I took so much of the time. I took the leverage of Manish not being out here. So Aurelia says, please don't say it. So I took 15 minutes. I'm late. I'm very sorry for taking so much of your time. I hope this would be of some use to you. Thank you so very much. There's one person who just entered. I do not know whether it is for Manish's class or mine. Roxy, I'm very sorry. I just finished my class.
Okay, okay.
You were late. I'm sorry. So this.
But I was the whole time. I just was checking the other meeting on Manish. I didn't know if he started already.
Today he was talking about some yoga session at park.
Okay.
So perhaps if you could go out for the park and enjoy the fresh sunlight and do yoga.
May I have a question? A last question, please.
Yes.
I understand. So I am very grateful for you, the things that you gave us today. I understand as well. I'm also working. I have been taught also to look for the cause of the problem and not work on the symptoms. And this is a very long time lesson. we always learn on that.
Yes, yes, yes.
Okay, and one thing which was retain my attention particularly today was this about the mantras. You know, I think this is a very, very important, a key thing, especially in very severe illnesses like cancer. And then my question is, maybe you answer now or next time. The question is, many people, especially here, Westerners, they just go, let's say, on internet, they see something on YouTube and they say, okay, I'm going to chant this mantra. I think this is a very, very delicate thing. And in my, let's say, education, mantras should be individually given by a specific person who really knows what you need. It's practically a resonance that you need at that time. And on the other hand, I also watched a video clip from Sadhguru, and he was telling that one woman lost her voice because she was just, let's say, carelessly reciting one Gayatri mantra or something like that. It's okay. And she simply lost her voice from that. Yeah? So this is something I feel the need to understand more. Maybe you emphasize more. How do we deal with that?
Mantras are basically for invocations. Invoking those deities, those Vedic deities within. Who are those Vedic deities? They are not somewhere out there in the clouds, but all of them are your positive emotions that you have within. It needs a lot of Shraddha, first of all. Shraddha is devotion, dedication, and trust with respect. So the first and foremost thing to learn mantra is Shraddha. The second thing is to learn the right order. It is very easy to just read the mantra, and hence we say incantations. You need to chant it. So when you chant, it means the word itself says there is some kind of order inside the mantra in which you have to chant it. So there are syllables where you have to put emphasis upon. There are syllables that you have to just, relaxed emphasis that you have to speak. There are syllables where you have to take it up to a higher note, take it low to a lower note, take it to a medial note, take it up twice, higher than the higher note. So there are very many variations, and hence you say in Gayatri Mantra, Om Bhur Bhuvas. Do you see? What did I do? Bhur Bhuvassuvaha Tatsaviturvare double Varendyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat. It needs Shraddha because it needs time to learn this. It's not easy. But just by very learning session, just by very listening to that chant, you get energized. You get all the positive deities, positive emotions, up in their order. And then you are definitely a new person yourself to, perceive the challenges of all challenges of your life. So Aurelia, you are very, very right. It needs a kind of, a guru to invoke that mantra yearning inside you. It is just not the desire that could help, but Shraddha, the trust and the time that you devote to learn mantras. But definitely, yes, when you continuously chant repetitively or listen to that chant repetitively, you are so attuned to it, then you start chanting in the same manner, how you listen to it, how you were, repetitively exercising over. It becomes natural. That's how I train my kids with Valmiki Ramayana, with Kanda Shashti Kavasam, an old chant of Tamil language. So my young boy, he's just 9. He says, "How is that I come to know the next chant all by myself?" I funnily said, "You were in my womb while I was chanting this." I said, "Oh, he's so excited. Oh, that's why I could know. That's why it is also there, but mostly because he has been continuously listening to it, and then he gets to know how to chant the next line all by himself. So that comes from instincts. That comes by constant exercising over the mantra, Aurelia. I hope I've answered your question. Is there any other question? Okay. Is there any suggestion for the next Sunday? If you have it all throughout the week, you have the entire week, you can just message Manish. Manish will let me know.
Yes, Lynn. I would like to hear more about how to introduce yogic practices to children.
To children, yes.
Where to start?
How old is your kid?
Where they're 5 and 9.
5 and 9. Okay. Best age to start with.
Yeah.
Best age to start with. Yes. The next topic would be on yoga for kids. Definitely. Thank you.
Thank you.
Thank you.
Okay. Bye.
Thank you.
Thank you.
Thanks. Bye.
Bye. Thank you.
Bye. Thank you.
Bye. Thank you.
Bye.
Namaste.